If you tuned in last Friday to Local Lifestyle, we told you a bit about the exciting new surgical robot at Deaconess Henderson. That robot needs a name, and your kiddos are invited to come up with one. Dr. Amber Coons, fresh out of surgery, by the way, is a general surgeon at Deaconess Henderson. Good morning.
Good morning. How are you?
I am great. And I'm really interested, first of all, to talk about the acquisition of the surgical robot. And tell us the story about that.
Yes. So I trained in residency on the robot. It was something that was just integral to our daily operations. And that was what I was really looking to bring here to Henderson. It took a bit of work and convincing, but I think that overall, we were able to, between myself and Dr. Sarah Onan, who's a gynecologist who also trained heavily on the robot, we were able to really convince the hospital system that this is good for the community, it's good for patient experience, and it's great for patient outcomes.
Well, let's talk about that then. So how does this improve patient both experience and outcome?
So it's minimally invasive, so similar to what you would expect with laparoscopic surgery. However, on the other side, as a surgeon, I have better dexterity. So it's like using my fingers. I have wrists, I have fingers, instead of using straight instruments, which is what typical laparoscopic surgery is. The incisions are still small, but they also tend to be less painful because of the design of the trocars, which are the little instruments that, like the portals that we use to get into the abdominal cavity. So that's helpful in that aspect. And then it's more along the lines of open surgery using your hands and the way that you can use them versus the laparoscopic instruments.
And so what types of surgery are ideally suited to use the Da Vinci robot?
So initially, when we roll out this program, we'll be focusing on abdominal wall hernias, so both like belly button hernias and groin hernias, and then gynecological procedures, so hysterectomies and that kind of thing. As our team gets their feet under them, we will be expanding more to hiatal hernia surgeries, colon surgeries, and going from there, because it really can be used for a variety of procedures. For example, if you have someone who does thoracic surgery, which we don't do in Henderson, but it's very good for the thoracic cavity as well, so lungs and that kind of thing.
Well, I can certainly see why you're excited about this for your work and for the community. Now we've got to name this robot, so tell us how we sign up our kiddos and what age group is involved.
Their ages 5 to 12. And they can either submit individually or they can submit as a classroom. I know a couple classrooms have. And the prize is a art package so that we can keep that creativity going and really engage that community.
All right, so the deadline is this Sunday, the 28th, yes?
It is, and we're announcing on the 1st. So get your entries in, and then we're going to go through them and announce everything. And hopefully we'll be able to do a little bit more for the winter as COVID things cool down. I'd like to get them in so they could actually see the robot, touch the robot. We have a simulator that it has some games on it so you can learn how to use the instruments and use the wrists. And it's a great experience, and so I want them to get the opportunity to.
Well, Amber, when that happens, please let us know because we'd love to cover it.
I will. I definitely will. I'd love for you guys to cover everything that we do with it.
Well, we're excited to have it here in our community. Thank you so much.
Thank you.
And Lifestyles will continue after this message. Stick around.